obviously have to talk about this study that just came out. This study is a really good example of not just reading the abstract. You really have to read the whole article, because if you just read the abstract, the take-home message is that if you as a patient have a complementary or alternative medicine integrated or instead of your standard of care treatment, you will have worse survival. But that's not really what this study says, so let's get into it. The first issue I have with this study is that they define complementary and alternative medicine as anything that's not recommended by a non-medical personnel. Now, I recommend complementary things to my patients all day, but I'm an MD PhD, so I'm a medical personnel. I do recommend things like massage, acupuncture, targeted supplements, but that's different than what this study is looking at. The second thing is, if you look at this graph right here, what you see is the survival of traditional plus complementary, and then it goes on to if you just didn't have the standard of care. And you can see survival gets worse. So once again, if you just look at this graph, your take-home message would be, if I have the standard of care, which is usually surgery, maybe radiation, maybe chemo, and add a complementary or alternative approach, I'm going to have a worse outcome. But that's not really what this paper showed, because if you move on to the next figure, what this shows is that patients who had a complementary or alternative thing, whatever that intervention was within their treatment plan, they were less likely to get the standard of care, meaning they were less likely to get radiation therapy or chemotherapy. Now, why is this? There's really two potential reasons, and a study like this just can't tease it out. The first is that patients who were at baseline less likely to have radiation therapy or chemotherapy, they're just not interested in it. Maybe they go out and seek out an alternative approach. That's one option. The second option is that patients who then seek out an alternative approach, complementary and alternative medicine, that's once again defined by this study as given by non-medical personnel. Maybe these non-medical personnel are somehow persuading patients not to have chemotherapy or radiation therapy. So we really can't tell that from the study. What I would love to see is a study that looks at patients who had surgery, radiation, chemo, so standard of care, with and without complementary and alternative medicine. Because without that one-to-one treatment, we can't really make a conclusion about the impact of complementary and alternative medicine on survival outcomes. If you've seen this study on social media, if you've even read it, send me a message. Let me know in the comments what you think.